Welcome, everyone. My name is Tiziana Sousou, and it is a pleasure for me to be part of this series, 5-part webinar series for international students. I am based in London, and we would love to get to know you and where you are from, which school you are participating in, and there will be a short poll now for you to fill in, so that we know who we're speaking to. May I please remind you, if you have any questions after the presentation, to raise your hand on your Zoom screen. And when you do ask a question, your name, your screen on, and also where you're from and which school you're in. And it is now a great honor to introduce Professor Lawrence Gostin, who will talk to us about preparing for the next pandemic. Professor Gostin is founding director of the O'Neill Institute for National and Global Health Law at the Georgetown Law Center. He is a leading scholar in the field of global health law. Larry serves as the director of the World Health Organization Collaborating Center on National and Global Health Law. The WHO Director General has previously appointed Larry to multiple high-level positions, including the International Health Regulations, IHR, roster of experts, and the Expert Advisory Panel on Mental Health. He has also served on numerous WHO expert advisory committees, including on the Pandemic Influenza Preparedness Framework and 2 global commissions to report on the lessons learned from the 2015 West Africa Ebola epidemic. In 2016, President Obama appointed Larry to a 6-year term on the President's National Cancer Advisory Board to advise the nation on cancer prevention, research, and policy. Larry also serves on the National Institutes of Health Directors Advisory Committee on the ethics of public-private partnerships to end the opioid crisis. In addition, Larry holds editorial appointments in leading academic journals throughout the world. He is the legal and global health correspondent for the Journal of the American Medical Association. He's also founding editor-in-chief of Laws, an international open access law journal. Over his illustrious career, Larry has received numerous awards and honors that recognize his distinguished service and dedication to using the law to improve the public health. He's a man of many accolades, and we are so pleased to have him speak with us today. Thank you.
Thank you very much. It's good morning to you, good afternoon, or good evening, depending upon where you are in the world. It's particularly enjoyable and a great privilege for me to talk to you in this webinar series, because I love the international students. I'm a globalist by heart. I believe we all live in a global world, and that we owe each other duties and love and compassion. And so it's really lovely to meet you all virtually. I'm going to talk about what else is there to talk about, the COVID pandemic. Basically, that's what we're all experiencing, and it's really, if you sit back, it's just really awesome when you think that Mother Nature has been so powerful. As recent as probably December, there was a new zoological jump from a bat to an intermediary species through to a human, most probably at the Wuhan market in Hubei province in China. And then it marched like a tsunami, first to East Asia, then to Europe, then the Americas, and now all over the world. And it's literally captured everyone. And all we have in response is our human ingenuity, our science, our public health. And we've made great strides in that, as I'll talk about. I've written about, and I think we've distributed a JAMA article where I talk about the great critical lessons thus far in the coronavirus pandemic. We're nowhere near ending it. We're probably got many more days ahead of us than we have behind us, but we will get out of it. I would expect by sometime in 2022, we will be reverting back to normal. So what are the lessons? I think the lessons are that we need to have a critical and resilient health system. Health systems are really important. And by health systems, I mean universal health coverage, so that everybody has access to health care. But I also mean public health systems and pandemic preparedness. The international health regulations prescribe what they call core system capacities. The international health regulations, by the way, are the governing framework for pandemic preparedness and response. 196 states parties, it's a WHO treaty. But they require things like surveillance, human resources, laboratory capacity, the ability to respond. They also require countries to rapidly report and respond to events. So health systems are critically important for us to be able to rapidly detect, respond, and bring under control novel viruses. Unfortunately, we weren't able to do that, and there's a WHO independent inquiry right now into the reasons why we were not able to curtail this virus sooner before it became a global pandemic. The second lesson is that leadership and public trust matter a lot. Before the pandemic hit, I was, and I still am, a member of the Global Health Security Index, which is a consortium of groups, including Johns Hopkins, the NTI, and the Economist in London, that really ranked countries in their pandemic preparedness. This is supplementary to the World Health Organization's joint external evaluation of health system preparedness. We ranked the United States first, and many European countries were very, very high in pandemic preparedness. And it turns out that the United States and many European countries were near last. And so the question is why? And the answer is that as strong a health system as you may have, you're still going to need leadership and public trust in that leadership to be able to implement an effective response. Now, I don't know if any of you saw the presidential debates last night, but it was an embarrassment for America. We didn't talk policy, we were at each other's throats. And that seems to be the way that we've handled this pandemic. There's been a lot of division, divisiveness, and undercutting. And so leadership does matter, and we need to have national plans, and countries that have done best have had those kinds of plans, and they've had quite good leadership. The countries that have had the most difficult time with COVID are those that have been quite nationalistic, quite populistic. The top 5 countries in the world in terms of deaths per capita are the United States, Brazil, India, the United Kingdom, and Mexico. All of them have populist leaders, nationalist leaders. Now, I'm not going to suggest that it's because of that they've done badly, but it's contributed to it, I think. The third critical lesson is, in my view, the most important of all lessons. If I look around the world, you can see different ways that countries have reacted. And the countries that have done best have all followed this critical lesson, which is the importance of the integrity of science and grounding your response on evidence-based scientific research, and having a clear and consistent message to the public about that. We actually, there's a lot we don't know about SARS-CoV-2, which is the virus that causes COVID-15, but we know a whole lot. And in fact, science has been remarkable, if you think about it. Within 1 week of the first report of COVID-19, or a novel coronavirus, they didn't even know it was coronavirus at the time, China had genetically sequenced the virus and shared it throughout the world. Since that time, we've learned a lot about the virus very, very quickly. We've learned that it's primarily transmitted through droplets in the air, that there is some aerosolized spread, although that's not the primary mode, but it is a mode of transmission. We've learned that public health interventions like social distancing, mask use that's universal, and good hand hygiene are all essential elements in this response. And so those countries that have followed the science, places, like Germany, Taiwan, Singapore, New Zealand, and a number of others, have done remarkably well. South Korea would be in that camp. But those who have had mixed messages where there's an undermining of science have done quite badly. Yesterday, I had an article in the Milbank Quarterly just really looking at the United States and how our core public health agencies like the US Centers for Disease Control and Prevention and the Food and Drug Administration have been undermined, sidelined, and contradicted by political leaders. And that's a recipe for disaster. We want strong, robust public health systems. We want them to be trusted by the public. And we want policies to be based upon the scientific evidence that we have available. Public health agencies in the United States are, in my view, not just among the best, but the best in the world, the US CDC, the US FDA. I think that we do have strong institutional guardrails against problems that will occur in the future, for example, on the approval of a safe and effective COVID-19 vaccine. But these agencies are under enormous pressure. I think they will bend, but I don't think that they're going to break because of our strong tradition and great career scientists in those agencies. The fourth lesson is about research and development. One of the things that has been remarkable is how quickly our R&D has done so well. We have a couple of approved treatments for COVID, including corticosteroid treatment and antiviral treatments. We also have lots of treatments that are in promising phases of development, like convalescent plasma and monoclonal antibodies. And so we've made really good progress. The biggest progress, though, is really astounding, is on vaccines. We currently globally have 9 vaccines in phase 3, which is final clinical trials. We have dozens in earlier human trials and hundreds in preclinical trials. We're likely to get more than one vaccine by the new year in 2021. and we're likely to have it beginning to have widespread distribution by the second or third quarter of 2021, at least in high-income countries. And I'm going to talk about lower-income countries in a minute through the COVAX facility. The fifth critical lesson is, it may not be the lesson that's determinative of how we respond, but it's the lesson to me that has the most moral power of all of the lessons we've learned. And that's the lessons of equity and justice. Even before COVID, we've had what I consider to be one prevailing global narrative, and that's the narrative of inequity and justice, the huge gaps in wealth and health between the rich and the poor, both within countries and among countries. Martin Luther King, the great civil rights leader in the United States, once said, in a way that was very impressive to me, all inequity is unjust, but the greatest injustice is health inequity. And we've seen enormous health disparities before COVID and things like, cancer, heart disease, longevity, you name it, HIV, AIDS, tuberculosis. But we've also seen it very, very clearly in COVID-19. If you have a lockdown and you're well off, if you can work remotely, if you've got a well-stocked refrigerator and cupboards, if you've got a steady income, you'll do fine. It's still hard, but you'll still do fine. But it's the poor, it's the essential workers, it's the health workers, it's those who live on the margins, those who are evicted from their homes or are homeless or in congregate settings like prisons, nursing homes, mental institutions. They're suffering, and they're suffering really, really badly. In the United States alone, you've got 3 times the per capita death rate among Black Americans as you do among white Americans, higher elevated rates among Native Americans and and Hispanics and Latinx populations. And so we're seeing enormous disparities. And so I think that the equity narrative, the justice narrative, is one that is very powerful and resonant. In the United States, we've also had protests around the country around Black Lives Matter movement and police violence. That's also been replicated in many, many parts of the world. And I don't think it's a coincidence that we have these racial protests and concerns over COVID. They are interrelated deeply, and they're related by the idea of the grave injustice racially, socioeconomically, and many other indicators. The sixth critical lesson is that we need evidence-based law and the rule of law. Evidence-based law means that our public policies and our laws need to be based upon the best science. In my career, I've often said, that the best science leads to the best ethics, which leads to the best laws. So science, law, ethics are all intertwined. But the rule of law is also important. The UN Secretary General developed a special commission on COVID and the rule of law. He was so concerned about populist leaders grabbing power using COVID as an excuse. In the United States, after 9/11 and the anthrax attacks, I had the privilege of leading a team that drafted the Model Emergency Health Powers Act on behalf of the CDC. And that has been adopted in most states in the United States and in many countries around the world. And I envisaged most of what happened, but I could never in my wildest dreams have imagined that we would completely lock down a city as large as Beijing, New York, London, Paris, or that we might even have a lockdown of Delhi and all of India, the largest lockdown in the history of the world. And so we are in unprecedented times, and human rights matters, justice matters, the rule of law matters. Now, I'm not opposed to any kinds of emergency measures that are well tailored. They're the least restrictive alternative, and they're absolutely necessary to save human life and health. I'm absolutely in favor of those, but we don't want to overreach. We don't want to forget human rights. We don't want to forget the rule of law. These are essential human and social values that we need to treasure. And the final lesson is the importance of global institutions. The Secretary General at this current UN General Assembly meeting, I thought said it best, basically that it is literally unconscionable that global institutions that have been put in such peril just at the time we need them most. And of course, I'm thinking of particularly the World Health Organization. It's simply wrong for WHO in the middle of a pandemic to be caught in a geopolitical strategic competition between the two world superpowers. It's simply wrong that the United States, which really gave birth to the UN and to WHO Constitution signed in New York City, that our president would give the Secretary General notice of our intention to withdraw from the organization. There'll be an election in between, but still, the symbolism of that is not one of global solidarity. At the same time, we're in a race for a vaccine, and that's good. We all want to see safe and effective vaccines, but we don't want political interference, and we don't want to rush the science. Already, Russia, China, and the United Arab Emirates have given emergency use authorizations, or in the case of Russia, full approval to a vaccine that hasn't made it out of phase 3 trials. In fact, the Russian vaccine was in first and second phase trials when it was approved. These are abdications of the responsibility and the integrity of science. We want to wait and let science play out. We want to make sure we have a safe and effective vaccine before it's deployed. And then what we want to do is we want to ramp up production for every human being on the globe and allocate priorities equitably. So in the United States, we have to figure out how we're going to give priority to those who have been hurt most, those in lower income parts of America, those who are in racial minorities, those with low socioeconomic status, frontline or essential workers, health workers, grocery workers, sanitation, and others. These are people that we need to give equitable priority to. Globally, we've already seen vaccine nationalism with countries like the UK, US, China, Russia, hoarding vaccines using pre-advance approvals, advance market commitments. And so they were taking up scarce supplies even before we get an approved vaccine. WHO and the Gavi Alliance have formed a magnificent alliance that is designed to do two things. One is to test vaccines against another, because we don't want the first vaccine, we want the best vaccine, and we want the best combination of vaccines. We're not going to know that without comparing vaccines. And we also need equitable distribution. There's no reason at all why somebody in a high-income country is more deserving to have a life-saving vaccine than somebody in a low-income country. And that is the aim and the mission of COVAX, and it's remarkable. Most countries in the world have signed up. We've got robust international cooperation, but 3 of the world superpowers have not: the US, Russia, and China. And so I would simply say that we have a choice going forward. when we come out of this pandemic. We can choose my country first, nationalism, populism. We can choose to reject or sideline or discount science, or we can invest in science, public health, in our national public health institutions and our global public health institutions. We have such hardworking women and men in these institutions, such great scientists, such great public health people. We need to show our support financially, politically, and in every other way. And we need to make sure that we follow the rule of law, the course of ethics, justice, equity, and human rights. That's the way forward, in my view. And I think if the world pulls together, and if we see what COVID has taught us, Mother Nature has taught us, is that we're all affected, we're all one humanity, we're all in this together. And the only way we can lift ourselves out of it is to pull together and to join together for a safer, healthier, and just world. And I can think of no better message to leave you with the lovely international students of Georgetown University. Thanks very much.
Thank you so much, Professor. There is Isabella Cristo, I think you are from Brazil, who has a question for you.
Yes. Can you all hear me?
I can, yes.
Okay, first of all, thank you
So
so
you're
much for the
the
lecture.
second worst performing country, and the US is the first.
Yes, we are never the first one. We never beat the US, even in that. Well, thank you so much for this lecture, Professor. It was a pleasure. It's so good to have a positive perspective on this moment that we're passing worldwide. I think my question will be more regarding geopolitics. I was in China during the beginning of the pandemics, and I've been studying the U.S.-China relations the past few years, and I think right now I can say that everything that I've studied, I couldn't never imagine what is happening right now with the U.S.-China relations, and also how Brazil is reacting to that. But I would like to know your opinion about that. I know there are many factors that is going to affect that, not only the pandemic itself, but also the elections in the US and also the Xi Jinping situation in China. But what do you think would be, is a very difficult question, but how things will be in the next few years?
Yeah, I mean, I know China very, very well. I go there all the time. My global health law book is translated into both simplified and traditional Chinese. So I have a very close relationship with Tsinghua and other universities there. You know, I said on Twitter a little while back, which is, you know, that it occurred to me because I had just done a session, you know, public session in China on COVID. And I said, you know, the fight between China and the United States is not between the Chinese people and the people of the United States. You know, this is a fight between the leaders. And I know the leaders have influenced a lot of the public to have antipathy to the other country. But this is wrong. You know, there are vast, you know, differences between the two countries. There's no question about it. And there are many things that I'm critical about the United States and our policy, but I'm also very critical about a number of things that go on in China, like with the Uyghurs and human rights and the disabling of civil society. But the idea that we're going to blame each other for the pandemic, that we're going to bring WHO in the middle of our spat, that there's going to be a trade war or even a Cold War. That's in nobody's interests. It's not in China's interest. It's not in the United States' interest. It's not in the globe's interest. You know, and if we want to, we've got some really hard problems facing the world, not just the pandemic. We've got the climate crisis. we've got food, scarcity of water. We've got so many problems that we have as a global community. I mean, Brazil with your rainforests is just one example. With indigenous communities, imagine if the United States and China were to actually unite and try to get behind each other in fighting these global problems. Imagine what we could do together. And I think if China and the United States were in alignment on many of these global issues, I think many other countries would come on board. And so it's a horrible missed opportunity. We're ruining the planet. We're bringing infections, plague, disease, climate change, food shortage, where our natural habitat is being destroyed, not just our forests, but our animals and our fish and all of our wildlife. What kind of a lesson are we leaving for our children that in the middle of all this we're going to fight? It just doesn't make sense to me. But will the US and China be fighting in 2 years? Yes, probably. Unfortunately, yes. Maybe not as bad as it is now. And a lot will depend on the election.
Thank you.
Professor, I actually have a question for you, because as I was reading your incredible career and how involved you've been with the WHO, I was wondering how you feel the current pandemic is going to change the role of the World Health Organization.
Yeah, I thought you were going to ask me about all my work in England and London, because I spent many years there, 15 years that I lived there. I know Dr. Tedros, the Director General of the WHO, very well personally. We just talked on the phone recently, and I also know most of the, probably most of the senior career staff there. WHO, in my 30 years working with them, can be, maddeningly bureaucratic and things, but they are hardworking, conscientious, and compassionate people. And particularly Dr. Tedros has got a great deal of compassion in him. And the organization is, make no mistake, demoralized. And Tedros said to me, he said, Larry, he says, when the US leaves, he says, it's not the money. I can easily make that up. It's the leadership, it's us being the solidarity. So I think this is going to have an impact on WHO. But, it's possible that WHO will come out stronger because of it, particularly if Biden is elected in the United States. On day one, he's going to cancel the withdrawal letter. And I think that people will rally around WHO. We're already seeing it, people in the European Union in particular, in Africa, have really rallied around the World Health Organization in very admirable ways. And China has made some noises in that direction as well, although its actions haven't been quite as clear. But I hope that, I said there were two paths coming out of this. One path is a strengthened, more vigorous, more politically and economically supported WHO. The other is that we splinter into kind of three international organizations. One is the US-led coalition, that might include the Global Fund, Gavi, and other polio eradication. One would be WHO, which would be European-led, African-led, and the like. And the third would be kind of China through its Belt and Road Initiative. That would be not unfortunate if you splintered in that way. I hope we will all rally around the World Health Organization. They deserve it, and we need them.
Ana Margarita Bash, I'm sorry if I say your name incorrectly. I think you have a question?
Yes, I do. You said well, Ana Margarita, it's fine.
And where are you from?
I'm from Venezuela. My name is in Spanish, but my family is originally from Germany, so Spanish and German.
I spent 8 months in Buenos Aires. It's a lovely city.
Really? Well, Buenos Aires is in
Hmm?
Argentina. I'm from Venezuela.
Oh, I thought you said Argentina. I thought you said Argentina. I'm sorry.
No, Venezuela.
No, I haven't been to Venezuela. I'm sorry. I thought you had said Argentina.
No, hopefully in the future. Well, let's see. I have a question for you because I'm architect. I'm from the School of Continuing Studies and I'm doing my master in real estate. One of the things that I have observed from this pandemic is that it has obligated us to change our habits. Now we have to work from home. We have to wear masks. We have to be more careful with our hand sanitizing and everything. So we have been changing our habits. And because of our habits, we have been destroyed the world by the way we live right now. We have been not paying attention to how we consume, how we use the product, how many plastic we use, many things that is affecting the oceans and the forest and everything. For the people that is not working in politician spheres that cannot make decisions, for instance, regarding public policy, I know that we can push and we can give our opinion, but in our daily life, regarding our habits or regarding how we can transform the architecture in our buildings, how do you think we could prepare, we can work better for the world regarding the pandemic, and also how can we prepare for a better world or for a next pandemic in that sense?
Yeah, I'm so glad you asked that question. It's a great question because you know what you've done is you've got to the essence of what each individual's responsibility is, and I love that. That's really great. So each of us need to make our own contribution, obviously. I saw, I don't know if you all know David Attenborough. He's a well-regarded naturalist from the UK. And he's been very active very recently on climate change, about individual, both societal and individual behavior. He had the distinction at 94 of being the fastest person to get to 1 million followers on Instagram. But they asked him that question, and he said, well, if you were going to say, well, what could any individual do just as an individual? I thought his answer was lovely. He said, don't waste. Don't have food waste, don't have plastic waste, don't waste energy, don't waste. And I think that's, so for each of us, if we don't waste, I think that would be a big difference. But he makes another point, which is really crucial, which is that, the problems that my generation are creating are going to affect your generation, and they're going to affect your children, you and your children. And it's unforgivable that we don't have the kind of responsibility and stewardship and nurturing of our planet that we should. And so I think, we're going to need the young people to actually, stand up and say no to my generation, and to work together toward the things we need. One of the byproducts of this pandemic has been. Are you getting an echo? Oh, one of the byproducts of this pandemic has been our environment has actually improved as we've driven cars less, as we've polluted less. Maybe we can sustain that.
Thank you.
So what do you think about I know from your point of view and being in touch with all these international associations, and I'm wondering what your view is of the political changes, both in Europe and the US, and how this pandemic can send us either right or left.
Yeah, well, right and left should maybe not be the main criteria. We've always looked at the right or left. The question is are we globalists? Do we believe in science? Do we have compassion? Do we believe in equity? And a lot of people on the left and the right blame each other. I'm kind of center left, but I don't have, I don't think of it as a left-right split. I think of it as we're in it together for equity, justice, human rights, the planet, using human beings' best scientific tools. And, so there are those that, split us apart, the populists, the nationalists, and there are populists and nationalists on the left and right. Mexico has a populist leftist leader. The US and Brazil on the right, Boris Johnson on the right. So we don't. So I don't know what it's going to do. I mean, I'm hopeful that we're going to come out of this more globally. I mean, I was really encouraged by one populist, Boris Johnson, in his UN General Assembly speech. I was on the BBC the other night, and I don't normally say nice things about Boris Johnson's handling of the pandemic, but I said credit where it's due. He got up and he acted like a globalist. He said, we're joining COVAX, we're increasing our WHO dues. We have to all work together for a vaccine. It needs to be equitable. Of course, the UK is one of the hoarders, one of the vaccine nationalists, but nonetheless, there are signs where where we're wanting to be together. And it's very possible, particularly after yesterday's presidential debates. I don't know if any of you saw it in the United States, but it was a national embarrassment, the way, just literally yelling and name calling at each other. And it just might be the American public is exhausted by it and wants to have some civility and decency and joining with the international community. One can only hope.
Thank you. I think Yvonne Quek also has a question. Yvonne, would you like to introduce yourself?
Yeah, hi, I'm Yvonne. I'm originally from Singapore. I'm also at the McDonough School of Business. I'm graduating next year. Hopefully, we have a graduation. So my question is, I have two questions. So one, you talked about the Global Health Security Index, that you were measuring countries' pandemic preparedness and realizing that the results were kind of flipped on its head when COVID happened. Do you think there's something different, that you're changing the indicators now on how you measure pandemic preparedness?
Yeah, we've got an article, I think, coming out. Well, we had one in JAMA and one coming out in the Lancet. We found, most of our indicators are right. And, places like Singapore have done quite well. And they have a good health system. Taiwan, South Korea, Germany, they all have good health systems and they've done well, so good health system is helpful. The UK should have done well with the national health system. The US should have done well because we do have a fairly good system, although it's not universal. But leadership matters. And so, yes, we're going to put a little bit more emphasis on the importance of leadership, public trust. The idea that, when a public leader says, scientists tell us that we really do need to socially distance, we really do need to wear masks. And if the population actually follows that advice, that would be well worth it. In some places, They follow it because, they're just more, caring about the common good. And, places like, Germany or in East Asia or in Singapore, I saw, you've done extraordinarily well, but you've got more of a strong leadership. Then you've got stiff fines if there is an abdication of social responsibility. So there are different ways of doing it, but ultimately you need to get the population to trust you and to do the right thing.
Well, thank you for that. And actually, my second question is on, you talked a lot about addressing inequities. So maybe if we focus on rolling out the vaccine, what are some ways that countries and systems can address some of the inequities that is bound to show up when I see that a lot of these injustices are systemic and stem a long way and bring in a lot of different factors? How would you be able to address that?
Yeah, I mean, I would do it twofold. I mean, firstly, on the general issue of inequity, setting aside COVID entirely, I've written a whole lot about structural ways you can lessen gaps in income and health. The main way is for us to focus on it. So what I've done is work with an international group of experts on something we call a national equity plans of action, so that you actually first measure the inequities, that is, where the health, who's suffering the worst health outcomes and in what areas and why. And then you actually have a well-funded action plan that's monitored to redress those. So that's one way of doing it. Another is just to have a strong social safety system. Many of the Scandinavian countries, for example, have better equity indicators, not perfect, but better. But they also have very high income, high productivity countries. So equity and productivity don't need to be in conflict. In relation to COVID in particular, there are very specific things we need to do. One of the most important now is about how we can ensure equitable access to the goods of scarce medical resources, personal protective equipment, medications, and most particularly vaccines. So each country needs to have an equity plan in their own country. The United States is developing one right now, the National Academy of Sciences and Medicine. I've just had a report out that's going to the CDC. I've got an article coming out in a major medical journal looking at how you can structure that, that takes account of inequity and socioeconomic status. The problem is with the changing Supreme Court, and we now have a fierce Supreme Court nomination battle with the death of Ruth Bader Ginsburg in the United States, that is really quite consequential. And because one of the things is that affirmative action is on the line in the United States. The Supreme Court, even right now, doesn't like to have race indicators for differences. And so if we prioritize people on the basis of race in the US, we might have a big constitutional battle and lose it. So I've recommended doing it on the basis of socioeconomic status, which captures race really, really well. And so all countries need to do that. And then we need to all support COVAX, which is a WHO-Gavi Alliance global scheme for equitable distribution between countries with higher and lower incomes.
Thank you. Wen Sue, could you introduce yourself?
Yeah, sure. Hello, Professor. I'm from mainland China. And I'm a freshman in college. This is my first year in Georgetown. I'm really intrigued by your point of like introducing how we should build trust and confidence among us. And I remember I once heard a claim that we've had a long period of expansion in the sense of globalization. And after the COVID, we should be entering the phase of contraction of globalization. So I just wonder, what's your prediction of globalization after this pandemic? And I also wonder, like, because you mentioned trust for several times, and I also think that is a very important element after pandemic. So I just wonder, how should we re-establish the trust and confidence to international cooperation, and what role do you think UN or WHO should play there?
Yes, those are two separate but interrelated questions. You know, it's not a very popular thing to say, but I'm a big supporter of globalization. I'm a big supporter of international trade. I think the global system that we brought in the Bretton Woods Accords in terms of expansion of globalized systems and international trade brought many decades of unparalleled increasing prosperity around the world. We were making enormous progress in lifting people out of absolute poverty, getting women into school and educated. We were reducing significantly child deaths, maternal deaths, making great strides with HIV, AIDS, TB, malaria. Longevity was always on the upward rise. Globalization played a big role in that. The problem is that we didn't focus on an equitable benefits of globalization. And so for me, the answer isn't, you know, retreat into your own country, you know, stop traveling, stop loving the other country, the other person, the other citizen, stop trading. The answer is to do so with an eye that lets everybody benefit from this. Yes, it's true that, you know, some globalization, some trade will take jobs away from one country to a lower paid country where there are lower paid workers. And we do need to be attentive to all of that. And we do need to, you know, have retraining for new kinds of jobs away from coal, pollution, manufacturing, and toward technology, green technology, and the like. So there are much better ways for us to achieve equity than each of us going into our silos. COVID may push us further into our silos. I know China is becoming more insular. It's depending upon its own internal market more. Russia even more so. The United States absolutely is. And even if Biden were elected, he's indicated now one of his core things would be Buy America. We're all basically retrenching into our nation states. I don't think that's a healthy thing for our global community. I think a better way is to continue globalization, continue trade, continue international diplomacy and dialogue, but paying attention, close attention to injustice.
Professor, one last question from Shimeng.
Hi, Professor Gostin. So I'm Shimeng. Oh, can you guys hear me? Yeah. Yeah, so I'm from China and currently a part-time MBA student from McDonald School of Business. So I read a news about like previously Bill Gates had like a speech talking about once the vaccine came out, the most important issue is to make sure they're distributed equally, not only reachable to rich people first. So like, I think earlier in the very beginning, like I think the COVID test was kind of similar, like politicians and also celebrities, they get tested first. And then also it's like in the hospital, if you don't have very severe symptoms, they won't even like have you do the tests. So I'm just wondering, like, once the vaccine's out in the future, how do you picture or seeing like the distribution of the vaccine?
Yeah, it's a good question. I mean, first of all, let me just simply say that the logistical and political task of having enough vaccine for the entire world is going to be enormous, absolutely enormous. And it's not going to be a magic bullet. It might only have 50 or 60% effectiveness, similar to a flu vaccine. Most of the phase 3 vaccine candidates are 2-dose. And so you need to double the dose. So let's assume we need more, between 6 and 7 billion people in the world. You're going to need 12, 13, 14 billion doses. Most of them need deep freeze storage. So how are we going to get it to rural areas, to poor areas without reliable electricity? Most of them are going to need syringes. They need a health workforce and infrastructure to develop it. They need public trust so that there isn't vaccine hesitancy or anti-vaccine sentiment. So many critical hurdles. And so we have a twofold challenge. One is a scientific logistical challenge to get a vaccine that in enough quantity and easy enough to distribute that it's feasible. And then we need to do so equitably so that cost is not a factor. I've often said that the COVID vaccine is the most important global public good I've seen in my lifetime. And by global public good, I mean everyone has an equal and fair chance of getting it. No one owns it. No country owns it. Nobody has intellectual property rights to it. And cost can't be an impediment to it. Those are the principles. Now we need to execute on them.
Thank you, Professor.
Thank you so much. This has been incredible, and you have managed to give us hope.
Oh, good.
Which is not easy in these times. I want to thank all the international students for joining us. And this has really been a wonderful kickstart to this webinar series. And I am excited that we're starting this, and very thankful for you to have given of your time. And I'm sure you're a very busy man. I just hope that you guys might want to join us for the second in the series, which will take place on October 14th at 9 a.m. US Eastern Time. And it will be with Ambassador Milan Bavir on the global challenge of women's equality. And you can sign up for this event on Global Georgetown website. And thank you to the Board of Regents for setting this up. And great meeting you all online.
Take care, everyone.
Thank you very much.
Bye.